a very elderly lady who had been feeling fatigued, miserable, short of breath for some time, basically because she had a slow heart rate. And I saw her, ended up putting in a pacemaker, and next morning she was feeling great. She's 94, but these were her words, that I feel like I can run the bakes now. The next day she was being discharged, and I actually ran into her in the hospital. She took my hands and said, God has given you a gift, thank you. And that was gratifying.
I chose cardiology because it has so many things we can do, and we can impact so many lives. In cardiology, we have tools where we can improve the circulation in the heart, we can improve the circulation in the legs, we can use pacemakers, but we also have ways where by improving cholesterol and diet in the patients, we can make them live longer. By treating them with very effective medications, we can prolong their lives. So cardiology has a big tent, and the vastness or the bigness of this tent really attracted me, that there are many things I can do. There's a great variety where we can touch people's lives.
So I have a very substantial family history myself. My dad died young, my brother is affected by heart disease, I had a cousin that died young, all my father's brothers had bypass surgery. So when I got out of college, I really thought that I would work with athletes, and I came across a job in a heart disease and diabetes center, and it just became a passion of mine. I so enjoy working with the patients that we see now, that so many of them are very thankful for the information that we give, for the guidance that we give them, and for their ability to go out and live healthier, make the right decisions, do the right things for themselves. I enjoy coming to work every single day and working with those patients.
I am passionate about cardiology because it's the #1 killer. 1 out of 3 deaths are from heart disease. And my dad, he passed away 2 years ago, 23 stents. And he had an open heart bypass at 48. So I have the genes for heart disease. But I don't put my genes in an environment where they will be subjected to heart disease. Instead, I take my genes and put them in a lifestyle that gives me a longer life and a healthier life.
This year's tournament is pretty personal to me. At the age of 59, I lost my dad in the middle of the night, who had a heart attack. And since starting at Trinity and learning about our amazing cardiovascular services program, particularly the Trinity program, I've often wondered if he would have known about that opportunity to learn a healthier lifestyle, if maybe his outcome would have been different. So my why today is in honor of my dad. And as my dad would say, hey diddle diddle, keep it in the middle.
The cardiology team, and I'm talking the team from the nurses to the techs to materials management to the receptionist, interact with our physicians, all with the sole purpose of making sure that our patients have the absolute best experience that they possibly can.
I have a few, but the first one was when I joined Quad Cities, and I was on call, and I was able to help a young person during a heart attack, and those, if left untreated, those still have a lot of big burden of mortality and morbidity, which means they either don't make it, or if they make it, they are left with severe congestive heart failure and other sequelae. So we were able to treat him appropriately. And then when I came out to talk to his mom, who was in the waiting area, she said, "You've saved actually my life," because she was totally dependent on him, and he was the breadwinner for his mom, and he used to take care of her from A to Z. So the look on her face and the gratitude she has was very touching at that time.
For me, it's getting called in the middle of the night. for an acute, a patient having a heart attack. So we have different types of heart attacks, and one heart attack is called a STEMI, which stands for ST elevated MI. That type of heart attack is for a complete blockage, and we have to respond. It's a life-saving, emergency. We have to respond within 30 minutes, and best case scenario is we have that artery open from 90 minutes to when they present into our ER. So our goal door to balloon time is 90 minutes, and after those 90 minutes, patient outcomes aren't as good. Life expectancy after a year is not as good, but in those instances, that is truly when we're saving a life. That is truly, if we wouldn't have been here within the 30 minutes, the patient wouldn't be alive. Though that's the best part of this job. And the people that stay here in the cath lab and take the crazy hours of call, they're the people that love that love saving the lives. So we do, we have a great team. It's hard, the call's hard, but it's the people that stay here, it's because they love that.
Cardiac rehab for about a year, just because I wanted to try something new. I didn't want to, but it wasn't too new because it was all cardiac related. So I wanted to go somewhere comfortable, and that's what CTU gave me. It actually has made me grow a lot. I've become a better, not only nurse, and I've learned so much down there, but just seeing the whole aspect of it. I only knew cardiac rehab, and now I know both sides of it, and so I really like that. Yeah, so our team downstairs, I love them all, and I only usually work 3 days a week down there, so I went from 3 to 2, and they're like, well, we're gonna miss you that one day, and I'm like, well, I'm still here. You still get to call me on the phone, and I'm up here. I still get to call you. So both teams here I really enjoy working with, and that's kind of one reason I came back to cardiac rehab, is I enjoyed my coworkers there, and I enjoy all my coworkers downstairs also.
So taking care of people is definitely the most rewarding portion of what we do every single day. See, when you come in and transform a person's life to a better one, that's when you walk out of that hospital at the end of the day and you're feeling good. And the day I walk out and I'm not feeling good, it means something was not perfect on that day. So really, it's really all about making a difference, in a person's life, a person who's not feeling well. In our job, in the cardiovascular world, that happens very frequently because many times people come very sick and they walk out very healthy. Healthy in a sense, feeling good, and suddenly they want to change their life, they want to do something good. That is the biggest reward that you get, as a physician who really cares about your patient.